So first of all, I'd like to just tell you a little more about the Global Business School for Health at UCL. Our story is an exceptional story. We are the first business school in the world totally dedicated to health and educating the next generation of health and healthcare professionals. We live in a very uncertain period. And as we know, we've recently experienced the pandemic, not in one country, but throughout the world. And that's had all sorts of implications on health and healthcare. But even before the pandemic, health and healthcare was becoming a bigger and more important topic in terms of health systems and economies around the world. Most countries today spend at least 10% of their gross national product on health and healthcare sector. In some countries, like the United States, they spend up to 18% of their GDP on health and healthcare related services. So these are very important sectors. Also, we've seen through the pandemic that regardless what kind of health system you had, it was strained. It was hard to keep dealing with our populations and making sure that they stay healthy, while also addressing the urgent need of people who were sick from COVID-19. So all of this has really crystallized into an understanding that health and healthcare is not just about professionals such as doctors or nurses, but it's really about the systems that we have in place, the way we manage those systems, the way we think about health and healthcare as we go forward. So in the Global Business School of Health, we're about reimagining global healthcare management, really thinking about the kind of systems that we put in place, the processes, things like supply chains, the way in which we manage our employees, how the workforce sits along technology, and how technology will be used in healthcare. Also looking at things like more emphasis on prevention and diagnostics rather than just on care. So this is a very exciting time to be in a part of the Global Business School of Health and to really not only get the business and management skills that leaders need, but also to contextualize it within this important and growing sector. So I'd like to start out by talking to you a little bit about our program that is our program in digital health and entrepreneurship. This program is really cutting edge. As we know, digital health is taking on a bigger and more prominent role within the health sector. And much of that is because we realize that we cannot train up enough health professionals to really meet the growing need. We need to be able to harness technology. Also, we want more of an emphasis on prevention and diagnostics rather than just on care. So that's where digital health is so important. It's also an enabler using digital health products. People with disabilities and health conditions that need monitored continuously can have a more fulfilling lifestyle by using technology in different ways. So this course really is an intense integrated course where you get a real grounding in understanding digital health and the fast-paced sector that it sits in. But you also develop those skills in terms of thinking strategically, understanding strategy, understanding the business sector, how to develop a startup, run a business, and how to really use innovation and health innovation in kind of conceptualizing different ideas. To enroll in this program, the admissions criteria is that you have to have a 2-1 or higher, which is, varies, of course, if you're in a different country, but that's kind of its equivalence in the UK. You also have to, of course, have an IELTS score or a similar test if you that shows that you have kind of the English competencies at a 6.5 or above, and with no area less than a 6. We also require a personal statement, and that's really important to us, that you tell us why you want to be on this course and what you hope to gain from it. We'll be publishing on our blog shortly an article about writing personal statements that you might find really useful. And then, of course, you also have to have a reference. And ideally, that should be an academic reference for this program. Also, I want to just tell you how the program runs, how it's structured, what you can expect on this program. This program will have a 1-week induction, and that induction is not just about telling you where your class is and where you can go, but it'll be about really helping you visualize what you want out of this program, what your journey will be. You'll also be invited prior to taking the program to take a number of self-paced courses online, one in particular in global health, so that everybody who comes into this program starts at about the same place. So we're not so concerned about what you've measured before. We're more concerned about your potential to really study and learn and in a digital health program. The program's made up of 180 credits. You'll take 8 compulsory modules, and each worth 15 credits, and you'll work on 2 projects. Those modules really are about preparing you and ensuring that you have the background to go into digital health. So you'll take a module in digital opportunities, one in digital health startups. You'll have another one that's really going to be focused on research methods in digital health. Digital health is an area that's not really a discipline, but it's a field. And so there's lots of questions about how do we show effectiveness? How do we show efficacy in digital health products and innovations? So that's going to be an important module for you in this course. We also are going to be looking at med tech. So you'll have a module in telemedicine and AI in that first term. So really interesting variety of courses. In your second term, you'll also take a course on changing health systems so that you can contextualize that and contextualize digital health in a number of settings. You'll also have a module around health assessments and understanding, the use of technology and how we value technology across. You'll, along with a marketing module, you will really get a grounding in digital health. And then last but not least, human factors of digital health. So all of these courses are really about preparing you to be an entrepreneur in the digital health space. Consequently, you've got 2 projects. One will be, of course, an individual research project that you and your supervisor will agree and you'll work on. And the second one is a group project that you'll be working on across the whole academic year. That project is about coming up with a digital health innovation and really developing a business case, the argument for that, and the pitch that you will deliver as a group as part of your final assessments. So it's a really interesting program, very dynamic, and will offer you and afford you many opportunities to develop yourself in this digital health space. The next program that I'd like to talk about is our MSc in Biotech and Pharmaceutical Management. This is, again, a very innovative program for people who are really looking to do something cutting edge in this space. This program is not about teaching you the science, but it's about teaching you how to take the science in business and really create that dynamic space. This is a sector, again, that's growing exponentially. As you know, there are many firms, both in biotech and pharmaceuticals, that are growing at a very rapid pace. So this business development and management perspective is imperative. There are lots of roles across pharmaceutical companies and biotech companies, as well as financial services, where you can use your skills. So this is really intended for people who may already have a science background, a health background, and really want to take it to the next level. Again, the admissions criteria is very similar to the digital health program. You need to have a UK degree at a 2-1 or above, or at least some extensive relevant work experience. And then your language requirement on this program is a 7 or above overall with a 6.5 on every subgroup. And again, your personal statement will be integral to us. We're really looking to understand why you'd want to do this program, what you hope to get out of this program, and how your experiences this far has really prepared you to come into this program. And then again, one reference will be required. So who is this program for? Well, this is really, as I said, it's for people who are ready to work in biotech or pharmaceutical, who want to cross over or already work in those sectors, but want to cross over into the management side of things. You might have a pharmaceutical degree, you might have a biotechnology degree, you might even have a health degree, and you want to really leverage that education into this very important and growing sector. You may work in consultancy, or you may work in finance and want to build your capacity and knowledge in biotech and pharmaceuticals. So this program is really ideal for people who see this as a place that they want to build a future career in. The program, again, has a 1-week induction where we will work with you to understand your ambitions, your expectations, help onboard you as a group, get a sense of belonging. You will also have an opportunity to take some self-paced courses, one, of course, in global health, but we'll have some other ones available as well. Things about study skills will be important, time management. The course has a similar format as our digital health. You take 6 compulsory 15-credit modules for this, 1 compulsory 30-credit module, and I'll talk about that in just a minute, and the 2 projects. So in term 1, you'll take a 30-credit module in clinical trials and statistics. It's a course imperative for anybody who wants to go into this sector. You'll also have a course in pharmacoeconomics, which is really about health assessments, and then you will have a module in term 1 in health policy or policies and practice in biotech and pharmaceuticals. And then in term 2, you've got really some very interesting and exciting courses. You've got one in capital and private equity, markets for healthcare, supply chain management for healthcare, and then you've got 2 that deal with the commercialization, both in terms of pharma, but also in biotech. So you have the commercialization of research ideas, which has a biotech focus, and then you've got the kind of commercialization and marketing of pharmaceuticals, which of course is focused on that industry. And the reason we split those out is we think that those are really very unique to those sectors, and we want to make sure you understand both of those. And last but not least, you will work on a business project, developing an idea either from an existing drug or biotech product that you can then take and develop and learn how to make a business plan and also how to pitch that business plan. So again, really important skills for going forward in the business and management area of these important sectors. And then you will also have the opportunity to do a research project that you will pick with your supervisor that really helps you develop and hone in and get depth in an area you're particularly interested in. So that's program leads me then to our 3rd MSc. This is called Global Healthcare Management with Roots. What do we mean by roots? Well, in this program, when you apply, you have to pick a specialism. So this is designed so that you can really get a good understanding of contemporary healthcare landscape while developing your leadership and management skills. It's you'll get all the kind of theories and practices and policies through your 4 core modules, but you'll also get some very specific knowledge in your specialism, your root, as we call them. And we have 3 roots on this program, or specialisms. So you can pick from healthcare analytics, healthcare finance, or healthcare leadership. So the admissions criteria for this program is similar to the other ones. Again, you need a UK degree. This one, it will offer people with lots of different backgrounds the opportunity to pivot into health and healthcare. So you can have a health, a science, a social science, or a business or related background, but you do need a 2.1 or above. In terms of language, you have to have a 6.5 or above on the IELTS, or with no area less than, I believe that should be a 6.0. And then you'll prepare a personal statement. And as I said, it will be really important for us to understand why you picked not just this program, but the specialism that you'd like to do in this program. We'll be very keen to understand that and how your previous experiences have heightened your interest to do this program. And then you need one reference. So who's this program for? Well, this is really for people who want to be managers, be change makers in the healthcare setting. You can be a new and recent graduate for this program, and really, if you've got some relevant work experience, please highlight that in your personal statement in your CV. And again, you'll get a 1-week induction on this program, an opportunity to really bond and get to know your colleagues, to really think about what you want out of the program. And of course, you'll have the opportunity to take a self-paced course in global health that we ask all of our students on all of our MSCs to take. So term 1 and term 2, I want to just spend a moment and tell you how this course will run. So you'll take 4 kind of what I call core compulsory modules. One of them will be around leadership and management in the healthcare sector. The second one will be about workforce and human resource management. The third one is about finance. And the fourth one is changing health systems and really understanding health systems. How those will play out, though, is they'll be broken up into 2 sets. So along with that, you'll take also across the year 4 modules in your specialism. So there we have 4 specialist finance health related modules, 4 specialized analytics modules, and 4 leadership modules. So in term 1, you'll take 2 of those core, and then you'll take 2 in your specialism. So you'll have 2 modules where you're with everyone who's in the global healthcare management MSc. And then you'll have 2 specialized modules with just the students that are doing your specialism. In term 2, you'll also have the opportunity to have 2 modules with everyone who's doing the global healthcare management and 2 modules with your specialism. You'll also work on a project like the other MSCs I've just spoken about, but this one will be about actually developing an idea about a healthcare improvement from concept to business case. And you will work in a group with people across all 3 specialisms. So one of the things that we're hoping to do with these group projects is really help you develop your team building skills, learn how to be part of a diverse, high-performing team to come up with either an idea or a solution. And in this case, a healthcare improvement. And then last but not least, you'll also get to do a 30-credit research project that you will choose with your supervisor. So students often ask about funding. At the Global Business School of Health at UCL, we've got 2 programs that our MSc students can apply to. One is Women Healthcare Leaders Scholarship. It's up to £5,000, but there's also an opportunity for those female students who demonstrate leadership potential to get extra coaching as part of this scholarship. They'll be part of a group that will have events and career coaching, extra career coaching throughout their journey with us. We also have a special scholarship for East London healthcare leaders. This one is designated for people either live in East London or who are working in the East London community, because our school will be located at UCL East, which is our East London campus. So those are two scholarships that we offer through the school, but UCL has an extensive range of scholarships. And I really encourage you to go to the link that's here on the screen, uclac.uk scholarships and scholarships finder, because there's lots of scholarships available. Also, if you're coming from the United States, you can apply for federal funding. There's also scholarships for UK residents through the government loan system. And there's also a number of scholarships that international students can apply to through different schemes offered also through the British Council and the Commonwealth. So please make sure that you take some time, not just to research programs, but research funding opportunities. I'd also want to talk to you a little bit about your career journey. The most important thing for us on all of our MSc programs is to make sure that you get the career outcomes that you expect. We'll spend a lot of time in the induction just focused on you personally and on your professional development, understanding where you are, where you want to be. Many students who come to the UK and do MSCs stay on as part of the post-study work for 2 years. So we want to work with you to help you find the kind of employment opportunities, possibly while you're doing the program. You can work up to 20 hours a week, but also after the program. So we will have our career professionals, and UCL Career Services is excellent and very good at really supporting our students. I also want to mention our innovation and enterprise services, because they'll be a very important component, particularly for many of the students who will come on our digital health course, but also possibly some of our other courses in our biotech and pharmaceutical management. These are all great opportunities for you to really tap into the fantastic services that UCL prides itself in. And then last but not least are our alumni. UCL has thousands of alumni across the world who are there eagerly waiting to mentor you, to get to know you. And also within the school, we'll have our industrial mentors. We will have, every project group will have industry mentors, either a firm or individuals who will work with you. We'll also, in the school, have a range of career coaching and industrial events that you can participate in. So really throughout the year, there'll be a full program of events, job opportunities, resources, and career workshops. We want to make sure that all of you not only complete the degree, get a fantastic education, but it really launches you for an exceptional transformative career. So some of the career destinations that we anticipate our students to have, of course, health consultancy, possibly working for one of the big four, PwC, Deloitte, KPMG, EY. There's also McKinsey and Boston Consulting Group. All of these firms are eagerly looking for top graduates in areas that we offer degrees. There's also, of course, management roles within big pharma, biotech, the National Health Service, the NHS here in the UK, Bupa, the World Health Organizations, and many other charities and other organizations that need healthcare management experts. So there's just such a wide range of opportunities. And of course, for many of you, you might want to actually have a startup or join a startup. And there are so many of those in the health tech and med tech sector that are looking for the talent that you will have and provide. So we really look forward to working with you throughout your journey with us to help you develop into the expert that you want to be. I also just want to talk in general about what it's like to be a student at UCL, because it is really an amazing, transformative, exciting experience. There's so many extracurricular activities and student support. And some of you might want to create your own club or society. So the Student Union sponsors a number of clubs. Right now we have over 250 clubs and societies at UCL. There's also 70 sports clubs and other activities that you can get involved in. Of course, volunteering is a great way to get some experience, to learn about an organization, and there are many opportunities with charities, with NHS trusts, with lots of different organizations. We also have other services for students to help you if you're feeling low or your well-being is not good, or you need some counseling or some mental health resources. We have a wonderful student support and well-being service and team that are ready to support you through your time at UCL. And then also the student union has their advice service that's available to answer your questions while you're with us. So there's lots of opportunities. There's going to be lots of activities and lots of sport within the Global Business School of Management, but also across UCL and into the wider community. And then I just want to take a moment to talk to you about the campus that you're going to be on. So we will be located on UCL's brand new UCL East campus in London. It's an extension of UCL's Bloomsbury campus. And it is just a beautiful place to be located in brand new buildings, state-of-the-art facilities that are in this heart of the former Olympic Park in Stratford, which is now called the Queen Elizabeth Olympic Park. It's a beautiful location. It's got water, it's got greenery. We also will have almost 600 bed spaces and rooms on this facility for students to stay. So the housing and student accommodations is wonderful. There are also a number of other universities located on the park. So it's just a fantastic student community to join. There'll also be museums. And then, of course, the Stratford and Hackney Wick area is known for exceptional dining of really lots of diverse kinds of cuisine. And shopping, of course, is there with the Westfield Shopping Center sitting just minutes away from the UCL East campus. So it is a fantastic place, along with sports facilities and opportunities to really engage in the local environment and have just a tremendous experience. And moreover, just being in London is just a fantastic place. Bloomsbury, the home of UCL, is an exciting place. There's tourist attractions everywhere, sports events, facilities, parks, greenery, gigs, festivals, museums, galleries, and institutes. UCL is part of a very vibrant city, and it's really embedded into the community. And so you will have such an incredible time in this city that's really rated #1 by students as a place to live. So lastly, I just want to mention a few events before I move to the Q&A. And just to let you know, we've got events running continuously over the next several months and then into the new year. I think if you can join us on the 24th, we've got a real great webinar around wearable technology and the future of healthcare that you'll find very exciting, with some leading experts talking about what their thoughts are about where wearables are going and the future in terms of wearable technology for health. We also, on December 9th, have two really people who have been at the forefront of the pharma and biotech and biopharmaceutical sector, who will join us and talk about their careers from really moving from the lab into the business of biotech and pharmaceutical industry. They'll be talking about the opportunities, what you can do with a career, what you can do with a degree in biotech and pharmaceutical management. So please join us for that. And then we've got a special event that will be live from Sri Lanka with health experts there around healthcare businesses and driving forward the innovation space that you can join online at 12 o'clock on December 4th. There are also many more events if you visit our website. So we do hope that you will join us and really take advantage of all that the UCL Global Business School for Health offers. It's a fantastic community to join, to be a part of, to be a student, and you'll find lots of people like yourself who really want to be change makers, who really want to define the health sector and make a difference, not just for themselves, but for patients. And so I really hope that you've enjoyed the presentation. I'm going to now take the presentation down so that I can now address your questions. But again, if there are anything that hasn't been covered today, you can find us at Global Business School Health at UCL. Just send us an email. We're very excited to answer your queries, engage with you in any way we can. So I'm going to now turn to the Q&A. Again, as I mentioned, the tab is at the bottom. I do see that we've had some interaction with that. If for some reason I don't get to your name, you can put your, or to your question, I'm sorry, you can put your name there or your email, or you can send us an email directly. We do want to make sure that we answer all of your questions. So again, thank you so much for joining me. And I'm now going to stop sharing my slides and move over to the Q&A. So the first question is from a student who has studied a BS in computing and information systems and was wondering if they still needed to submit IELTS when applying for the MSc. I'm not sure about that. I suggest that you contact admissions, but I would assume you would not have to if you've got a UK bachelor's degree that you're completing here. The next question, I was wondering, do applicants have to submit a transcript on the application? Yes, that you do have to submit your qualifications. Yes, I realize that it can take 2 to 3 weeks for those official transcripts to be generated. Can I submit the application first and then supplement with the transcripts? Yes, you can. You can go ahead, put your application in, and then request the transcripts. And then as soon as your application is finished, we can take a look at it. I have another student. Hi, I'm an engineering graduate with a strong mathematics background and an experience of 2.5 years in analytics from India. Could you please tell me if I'm suitable for the Strategic Management for Projects Masters program? That program lies outside of this school. So I think what you need to do is maybe write to them directly. Also, can we apply for more than one course in a coming academic year? Yes, you can. You can apply for more than one course. You can apply up to 2 courses at UCL. Also, is there a minimum work experience for the MBA offered at UCL? For the MBA Health, we prefer students to have 3 years of work experience, and you can design and talk to us about what constitutes those 3 years. But yes, you do need some work experience to apply for the MBA. Hi, Nora Colton. What are the advantages of GPSH programs compared to IC International Management programs such as employability, career support, teaching quality, and professional networks? So I'm not really that familiar with IC International Management programs, but I can tell you that the UCL Global Business School for Health is really an exceptional place to in terms of career support. All of our programs, by the way, have been designed with employers. We undertook extensive employer surveys, not just in the UK, but around the world. Also, we will have a number of, as I mentioned already, you'll have industrial mentors, people who are already in the field, professionals who will actually be supporting you as you develop your projects. So it's an incredible time to get to know them. We'll also have career support and workshops across the year. will be working with you and with UCL Career Services to make sure that you get the employment opportunities that you're looking for. That's why we really start with induction. Our induction is very much focused on careers, making sure we understand your expectations and that you understand the opportunities. So I would imagine that we're quite exceptional in terms of what we offer and the way that you'll get to informally as well as formally network with mentors. We also have for our MBA what we call executives in residence. These are CEOs and former CEOs who are there to really, offer career advice, support, as students go through the journey. And they will have regular office hours available for those students. Hi, I have an undergraduate degree in finance, but I'm very interested in digital health and entrepreneurship, and my personal experience is a good match for the program. So I'd like to ask if the program will consider applications from finance managers. Absolutely. Any kind of business finance background is ideal. And we're really looking in all of these programs. We've tried to design them so that the entry criteria is as broad as it could possibly be, because we realize that many people in their undergraduate degree may not have thought about healthcare management as a field of study. So we want to be able to allow people to really pivot over into this sector and to really build up a body of knowledge and experience that they can then take forward. So absolutely, definitely apply, and make sure in your personal statement to talk about why you think you're a good match and your experiences. Hello, concerning the language requirement, if someone has an overall 6.5 instead of a 7, but an 18-month experience in the UK, is there any likelihood of being accepted onto the master's programs? Well, all of the master's programs, except biotech and pharmaceutical management, have an overall of 6.5. So if you've got an overall of 6.5 and you want to apply to those degrees, you should be okay. If you're applying to biotech and pharmaceutical management, you will need an overall of 7. Those are not really something we can be flexible with. So if you've had 18 months experience in the UK, what I'd really encourage you to do, you can apply before you've actually taken your IELTS. I would suggest that you take your IELTS again, and hopefully now you can score a 7. So this is a really good question. Is it possible to change routes or specialisms when admitted into the MSc Global Health Management with roots? Unfortunately, it's not, because we've actually structured the program so that in your first term, you're taking 2 courses that are core to everyone and 2 courses in your specialism. The reason we did that is that we wanted you to be able to start learning in your specialism from term 1. And so and also be able to be part of this broader community throughout your year. And also because your group project will be very mixed in terms of people from different specialisms. So you do need to make a decision if you're going to apply for the global healthcare management, which route you want to do. Next question, how much importance does this course give to balanced studies with a relevant full-time job? These are really designed as full-time courses. So if you've got a full-time job, you can take them as part-time or flexible, but your employer would have to be willing to allow you to have some time out of the day to attend class. They're usually going to be ran over 2 to 3 days. So there is a bit of flexibility. But I would assume if you're full-time, you'd want to do a part-time or a flexible route. A flexible route allow you to take it over 3 to 5 years. That way you can build your kind of work around the courses. So I think it's really important to have that conversation with us. We'd be happy to talk to you about just how, what days different modules are on once they're timetabled, and to help you make that work. The next question, there are too many parts we want to cover on the personal statement and the CV. Which part is the most important for GBSH? I would suggest that in your personal statement, you make it very succinct. It just needs to be about no more than a couple pages. You know, the first paragraph, really try to make something very memorable about you. You know, very clear about why you're interested in this program. Then in the body, you know, focus on experiences, things that might be relevant. We're really looking for people who are passionate about making a difference to health and healthcare systems. So that needs to come across very clearly. So don't just focus on your past experiences. You can put your past experiences in your CV. And in your personal statement, focus more on your motivation, your resilience, your ability to complete the program, and also to be a team player. Be somebody who's really going to contribute back to the program as well as take from the program. The next question is, the digital health course. I already work in the field and would like to remain in employment during the course. I have two questions concerning the part-time option. How are the classes scheduled, 1 day per week, or modules in blocks? Two, how is the group project going to work, for example, just with other part-time students? Okay, that's a really important question. So if you're taking it as a part-time, you can probably, you wouldn't have more than 1 or 2 days that you'd be expected, depending on the class schedule. So these are not, digital health's not offered as a block. It's offered across. So you'd need 1 or 2 days, probably 1 day where you would need to be present across the semester and the week. And if you email us, I'm sure that we can give you an idea of kind of the day of the week that you would need to have that availability. And that would be across 10 weeks. Then 10 weeks in the kind of fall, autumn, and then 10 weeks in the kind of winter, spring time. In terms of the project really is something that you'd work with your team. So yes, it could be that we'll group part-time students together, and it would be something that you would work, you know, online and with your colleagues outside of class. So there may be some workshops that you have to attend, but the program is really designed to give that kind of, the project isn't going to have a set timetable area, other than there may be some workshops that we ask you to attend, you know, that will be booked in across the year, just so that we can assure that you're, you know, getting on and that the group is getting on. And there also might be some times at those workshops where you'll meet with your industry mentors. May I ask that the IELTS requirements of global healthcare management is 6.56 in the offer. There is a mistake on the PDF, PPT. Yes, you're right. That's correct. Hi, Professor. I wonder whether the MSc Health Economics and Decision Science is under this new faculty. No, it remains at the Institute of Global Health and is separate from this faculty. Please explain pharmaceutical courses, the master's. Okay, the master's is really it's in biotech and pharmaceutical management. So I want to just emphasize, it's a management course. It's designed for people, ideally, who might have already a bachelor's in pharmacy or a degree in biotechnology or science or health, who really want to go into the business and management side. Also, you might be somebody who's got you know, been working in a lab, maybe you already work in biotech or pharmaceutical, and you want to move up into a management route. So that's who the course is really designed for. And the way it is structured then is to really give you a solid background of policies, practices, regulations, the kind of finances of biotech and pharmaceutical. How do you take ideas, research ideas, commercialization of biotech and pharmaceutical? So it's really very much focused on business, product development, taking something through clinical trials, taking something to market. So you will not get science skills in this course. You will get business and management skills that are extremely relevant to the pharmaceutical and biotech management side. Hello, I'm majoring in financial management. I've submitted the application for the Master's in Digital Health Entrepreneurship. If I am admitted, do I need to learn the course of digital technology in advance? No, you don't. The course is about teaching you about digital health and technology. So that's not something we would expect you to come in with prior knowledge. You'll get that knowledge as you move through the course. Hello, I just wanted to ask you to maybe give a brief description on the difference between part-time and full-time study. Would I have enough time to work with part-time study? Ideally, you will be studying 2, maximum 3 days a week, and probably on the third day it would just be for one module, and it may be in one semester. So you do have time to have a part-time job. Many of the master's students at UCL do undertake part-time work. So in terms of part-time, full-time, it's really, the difference is a full-time student will take 4 modules per term in term 1 and term 2. In term 3, they'll be working mainly independently on their research project, and they'll be finishing off their group project. So the group project and the individual research project are really timetabled for term 3. So in term 3, you'll have more time on your hands. So in terms of full-time or part-time work, I wouldn't, or study, I'm sorry. If you're taking it full-time, then you take 4 modules term 1, 4 modules term 2, and then in term 3, you've got your 2 projects. If you're taking it as a part-time student, you take 2 modules. So that's why you would probably only come to campus 1, maybe 2 days a week, or 1.5 days a week. Because you would only take 2 modules in term 1, 2 modules in term 2. You'd work on 1 project in term 3, and that would constitute year 1. In year 2, you take the next 2 modules. You take in term 2, you take the next 2 modules, and then in term 3, that final summer, you take the second project. So that's how it would work for a part-time student. Again, if you have any further questions, please let us know. How many students will be admitted to the Global Healthcare Management Program? Currently, we're looking at 60 students, but because we can see this program is very much in demand, as well as our other programs, there's some flexibility there, and we may increase the numbers. Hi, how many students will each major admit? So as I just said, I think, I can see many people have received offers already. Yes, we've already started making some offers. We use rolling admissions at UCL. So if you're interested in these programs, I highly recommend that you start to get your application in as soon as possible. We are still reviewing applications, and we haven't filled any of our programs yet. Hi, as a student studying finance and accounting, I do not have any knowledge or experience in medical or health. Would this be allowed to enter this program? Yes, it will. And that's why all students coming into any of these programs are asked to complete an online module in global health. That's to help prepare you and to level the playing field so that everyone comes in with at least some basic knowledge. Yes, thank you. I have a question about the MSc Health Economics. Will the lecture seminars be held online or will they be in person? That program doesn't sit in our school. So I would suggest that you write the department that program does sit in. Hi, would you need an IELTS if your BSc is from University of London distance learning? Again, I don't have the answer to that. You can email us or you can write directly to the admissions office and they should be able to tell you. Hi, if the program does not require a GMAT GRE test, will submitting such a score strengthen my application? You're welcome to submit a GMAT GRE score, but we don't require it for the master's. We do require it for the MBA Health. So if you have a score and want to apply to that program, we would be taking it into consideration. But these MSCs don't require it. So it's up to you if you submit it, but it's not part of the application requirements. Hi, does Global Health Care Management Finance have an interview online? No, none of the MSCs have online interviews. The only program we have where we do interviews is our MBA Health. Hi, can you say how would studying this course part-time work out? I'm currently doing my 4th year of in pharmacy and was considering doing this course part-time while doing my pre-reg next year. Is it possible? Yes, I think it is possible. What I'd suggest you do is that you write to us and the administrator can let you know just how that would break down part-time. Hi, I am curious, how many courses can I apply at the same time? Are the 2 courses the maximum? Yes, 2 courses are the maximum if the 2 courses are at UCL. Hi, Nora Colton. Could you tell me how many seats available in global healthcare management with Roots leadership? As I said earlier, currently we're looking to bring 20 students on to each specialism, but there's a strong possibility that we'll be increasing that. Hi, can I apply to 2 majors of GBSH? Does a major admit students from the same school? Yes, you can apply to 2 programs within GBSH. But then you cannot, the total is just across UCL. Hi, may I know more about the MSc Venture Capital and Private Equity program? How big is the current class, average years of work experience, industry exposure? Thank you. That program sits outside of the Global Business School of Health. So you need to contact the Institute of Finance and Technology directly to get that answer. Hi, Nora. Thank you very much for your presentation. I'd like to ask whether the offer has been sent out now and has the material review begun now. We are doing what we call rolling admissions. So if you've submitted an application, we are going through those and we are reviewing material as it comes in. So once an application is completed, we review the material. It normally takes at UCL, it can take up to 6 weeks before you get an answer on your application. So do be patient with us. We are receiving lots of applications. Consequently, if you want to apply for these programs, I suggest you get your application in as soon as possible. Hello, for the academic references, do we submit it along with our application or do we just mention the contact details of our academic references? I'm not really sure, but again, if you start the application process, they should indicate to you. I believe what happens is you give the contact details and they would contact your academic reference. Hi, what's the anticipated diversity in the GBSH? Will the GBSH be overwhelmed by Chinese students? GBSH will have a variety of students from all over the world. Really, the idea here is to have people from different health systems to come together. So of course we'll have Chinese students, but we'll have students from other parts of the world as well as the UK. It's really important to us to be able to offer a diversity of perspectives and to really have a group of students that can share amongst themselves their experiences in different health systems. And also part of what we want to do is really be part of that wider conversation. Hi, Professor, do we have a video interview? Not on the MSc. You would have an interview if you're doing the MBA in health. Hi, I've got my oncology master's degree and preventative bachelor's and have now worked at J&J for 3 years. Can I apply for health economics MSc? Again, health economics MSc sits outside of this school, so please contact the Institute of Global Health. Following up from the work experience question, can one apply without work experience as a recent graduate? Yes, the master's degrees do not require work experience. Of course, it's always a plus to have some work experience, but the MBA requires work experience. Hello, I'm an entrepreneur and I started my business 2 years back, but I would like to get more knowledge from business schools. What type of supporting documents do I need to submit to back my work experience? Again, we would be looking for your CV and your also your personal statement. And you might also want to look at our MBA in health because it might be a much better kind of match for your background. I applied for the VCPA with FinTech around the 24th of October, and now I've received nothing while other program gave me offer to applicants. I want to know the time result of this program. That program does not sit in our school. So I think what you'd have to do is go back to that program and that department to find out. Hello, I'm a student from China. I recently submitted an application. I wonder, is it possible for international students to gain opportunities working in London after graduation with the aid of resources offered by UCL? Yes, it is. And actually, we have post-study work here in the UK. So as when you complete your master's, you can stay up to 2 years. Also, while you're doing your master's, you have the opportunity to work part-time. You can work up to 20 hours a week. So there's plenty of opportunities for you to work while you're doing your degree, and then also the next few years after your degree. I have a question about the MSc Health Economics. Again, as I mentioned previously, that doesn't sit in this department, Samuel, so you need to go to them. But I'm sure they'd be happy to answer your questions. Hi, in my submitted application, I wrongly submitted the file of my transcript. Could the file be replaced in the application documents? Yes, you need to contact the admissions so that they do that correction for you. Hi, I'm currently a third-year student and would it be ideal to submit the application before the Christmas holidays or beginning of the second term? Should my third term performance be included in my application? I would suggest that you get your application in now. If you're a third-year student, you submit up to the holidays. I think there should be enough indication of how you've done so far. And if you've got a 2.1 and above, I would strongly recommend that you get your application in now, and then you will get a conditional offer for when you actually finish off your third year. What would make an outstanding MSc candidate for UCL, especially what you would look for in a personal statement? What we're really looking for in a personal statement is not so much what people have done in the past, although that's important in terms of context, but it's really about your ambition? What do you want out of the program? Where are you going forward? That's really important to us to understand, why you're picking a particular, say, specialism on the global healthcare management, or why do you want biotech and pharmaceutical management? And what are your career aspirations? Where would you like to go in the future? And maybe an example of, how you've demonstrated resilience, had an experience in life or in your education journey that really demonstrate that, even if the work turns out to be very difficult, that you've got that resilience to stick to it and move through the program. If the year 3 grades didn't reach a 2.1 or didn't reach some of the requirements from now or on, but will hand in the related requirements in the future, will it be possible to get a conditional offer? It is possible if you're very close to a 2.1 and you've got a very strong personal statement. You could still get an offer on the anticipation, but you would get a conditional offer and you would need to get that 2.1 to get a final admission into the program. Hi, how many students will be admitted to each track in the global healthcare management? As I said to you earlier, probably between 20 to 50. We're still looking at that, and we might increase the number. So I would still encourage you very much to apply to what you're interested in. We do take a very thoughtful approach to selecting those people that we admit. Besides, do experiences in the healthcare field will be necessary in applying for these programs? No, you don't have to, but you have to show a willingness and interest in health and healthcare. So we really look very closely at applicants who come from different backgrounds to understand what is, just as I said a minute ago, what's your motivation? Why do you want to do these programs? What are you hoping to get out of them? That's going to, and what is your career aspirations? That's really important to us. Hi, Professor Colton. I've taken courses related to Social Security, business, and medicine. Can I apply for the MSc Global Healthcare Management with Roots? Of course you can. That's a great background and very complementary to what you would do in the program. If I apply for both routes of MSc Global Healthcare Management, will the two applications be considered separately? I'm interested in two routes at once. Yes, if you apply to two routes, of course you can only, accept one, but you can be considered for both. Hello, I'm interested in the global healthcare management with Roots leadership. Can you give some examples of what internships or undergraduate courses are best related to this? Well, I think the leadership is a very wide area. So I think you can come from really a number of undergraduate courses, possibly business, finance, economics, health, healthcare, medicine. The whole idea of the global healthcare management, though, and particularly the leadership route, you would be someone who's very interested in becoming a leader, a senior leader, an executive eventually in healthcare management. That would be the sector and place that you'd like to make a difference. So that could be, you might want to be in a hospital and be eventually a part of a senior executive team. You might want to be in a healthcare insurance company or lead a charity in healthcare. You might want to, work in pharmaceuticals or biotech, or even in a company like Amazon or Google in their healthcare units in a management capacity. So the key here is really about leadership and management. You've got to really want to do that in the healthcare sector. And of course, last but not least, to really make a difference, to have an aspiration of being that kind of change maker. Hi, I am 0.5% away from an overseas 2.1 equivalent, but my school doesn't offer courses for senior year students. Will the Global Healthcare Management Program consider my application? We'll consider your application, and particularly if you're very close to a 2.1, you've got a really compelling personal statement, you still have an opportunity to be accepted into the program. Who retains the intellectual property for a product developed by students, UCL or just the students? Well, that's a really important question, and it comes up all the time. These are really opportunities, intellectual opportunities. So we don't see the products per se. You won't be developing products. You'll be developing business plans around a concept and an idea for a product. And so if you were to go out afterwards and develop the product, of course, that IP would be yours. If UCL and UCL academics develop the IP, then that remains in UCL. So I just want to be clear. That's why what you're putting together for your project isn't actually the product itself. It's the pitch and the business plan that would lead to developing that product, if that makes sense. So the ideas, and of course, many people can have ideas, but it's the person who actually then takes it forward and develops that idea. Hi, how much flexibility can be a part-time master's if you want to combine it with a full-time job? For example, 2 times per week, or how many hours roughly per week? Could you let me know if next year, 2022, some courses are going to be online? So that's a really important question. As I've already said, we anticipate that you probably need to be around and on campus 2 days a week for most of these. But if you were part-time, you could come 1 day a week. We're putting together our timetables. So if you write to us directly and you tell us which program you're interested in, we can give you an indication. It could change of what that part-time journey would look like. There will be some online learning for all our program. We've found through feedback over the pandemic that large lectures are better done online, and then seminars are better done face-to-face, and interactive activities and events. So you'll get a mix, but whole courses will not run online. There's only one course, maybe 2 courses, and those are indicated already. Those are courses that we'll be using from other departments. So again, if you let me know, write to us and tell us what course you're interested in, I think we can be more precise. But all of our programs, as they're designed currently, require students to be face-to-face, for at least even a part-time student would have to have a day a week. Hello, can I ask how many people will be admitted in these 3 majors? Thanks in advance. As I said, we're just reviewing applications now. And so it's really hard to tell you exactly how many students. But we imagine between, of course, global health care management, each track will be treated as an individual. And upwards to 30 to 50 is what we're looking at currently. Hello, may I ask how long I will receive the application results? It's been submitted on November 12th. UCL says that it can take up to 6 weeks to review and look at an application. So if you've just submitted it, I think you need to be a bit more patient, and hopefully you'll get an answer soon. How many students will be admitted to the global healthcare management or global health management with finance? As I said, probably we're looking between 30 and 50. Depending on the quality of the applications and the number of applications that we receive. How many conditional offers will be issued? So conditional offers are really, we don't look at applications that way. If somebody is still completing a degree, they get a conditional application. So, and if there are things like IELTS and these sorts of matters. So we really take a holistic approach. There's no kind of limit or quota on conditional offers. Hi, I was wondering what academic heuristics of applicants will be valued in the global healthcare management leadership. Does it need some quantitative background? Thank you. No, again, as I've already said, we're looking for people who are well-rounded, who know and have an interest, not just an interest, I'd say, know what they want out of that leadership route and you know why they've selected that and where they're going. And I think that's really important for us is to understand why the leadership route, why not the finance, why not the analytics, why not something else. So I think it's really making a case for that particular program. Hi, could you tell me how many remaining seats available in global healthcare management with Roots leadership? Well, I really don't know that answer. And as I said, we're looking at applications now. We haven't closed any applications. So, you know, there's still spaces available for, you know, applicants. Hi, Nora. Does a major admit students from the same school? Yeah, I'm not sure I quite understand that. But I think what you're saying is if you're in one school and you want to do a master's in the same school, can you? And yes, that answer would be yes. I graduated over 10 years ago. Are you accepting professional references instead of academics? Absolutely. And actually, if you've got that much work experience, you might take a look at the MBA Health. It might be a more appropriate program for you. Hi, can I submit more than one reference? I think if you're applying to the master's, no. If you're applying for the MBA, yes, you can submit up to 2 references for that. But for the master's program, it's only 1 required. So you just need to make sure, look for somebody who can really knows you, who can give you a very high quality reference. Hi, Nora, thanks for sharing. I heard that over 30 Chinese students had received the Global Healthcare Management Finance offer, which significantly outnumbers the class size. Is this news true? Well, I don't know where you're getting your news, but I think that, you know, there have been a number of offers made on the Global Healthcare Management with finance. There's a lot of interest in that program. So I'm not sure exactly how many of those applicants are Chinese. Hi, Nora. I had received conditional offer from GBSH. If I meet the requirements when I graduate, could I definitely get an unconditional offer? Yes, if you've been given a conditional offer and you've accepted that, then you just need to make sure that you meet the condition. Hi, I've graduated. May I ask if I need to indicate my score in my CV or just upload the transcript? You just upload the transcript. We look to the transcript to make that assessment. Would a personal statement of 500 to 800 words be recommended? Yeah, that seems very appropriate. And again, as I said, it's not about length. It's really about the quality of making the case of why you should be selected for this program. Hello, is there high quantitative requirements for digital health, digital, and entrepreneurship? There is some quantitative aspects, and there is a research methods course for that. And I guess high quantitative is very relative. But I think you know, having a knowledge or a background in you know, and some quantitative skills is a value added for that program. Is there any rejection offer in this project now? Or to say that long time without news is meaning on the wait list? Again, you know, we've gotten a lot of applications very close together. So we're working through those. So it does not mean you're on the wait list, and it doesn't mean that you know, you're still being considered. So I just recommend that you be a bit patient. Hi, will there be a notice for when the applications are closing? Yes, right now our application deadline is March 31st. If we close before March 31st, we'll make sure to indicate that. Hello, so the applications will be closed as soon as the class size is full. We will, like I said, we'll be reviewing that periodically. And if there's an indication and a reason that we should close early, we will do that. Hello, Nora. Okay. Hi, Professor. Could you introduce the 3 routes of the global healthcare management, please? I want to know more about these different routes. I would really suggest that you actually go to our website. If you go to the website you just, go to a search engine and put in UCL Global Business School for Health, go to study, and then go to the Global Healthcare Management Program. You'll see the 3 routes, and you can see under program, you can see the 4 modules that you take as part of your specialism on each of those. I think that's the best way to go about it. I am an undergraduate. Does my academic reference have to be from a professor who has taught me? Well, ideally, you would want your reference to be somebody who's taught you and knows you. The most important thing about academic references is you want someone who understands your work and your ability to succeed in this program. Hi, Nora. Will this program be closed in advance? Well, I'm not sure what program you're talking about, but there will be, a point where the programs will fill, and we may need to close some of these programs early. Hi, I majored in pharmacy and minored in finance as an undergraduate. However, I have a little experience in healthcare, but in a recent course I found that I'm very interested in healthcare and have some ideas. In PS, should I elaborate more on my ideas that are not put in practice, or more or less on my relevant experience, least relevant practice? I think really, again, personal statements are about your intent, why you're doing the program, what is it that you want out of the program, and what are your kind of career aspirations, and that's what really we're looking for. And then other kind of personal characteristic or traits are team player, being able to, as I said earlier, not just take from the program, but add value to the program. That's really important. And that resilience to be able to come and succeed. Hi, I have got the conditional offer, but it said that UCL may finally recalculate the GPA on the situation. Will this affect me to get an unconditional offer? Without knowing the details, I would suggest that you just write to the admissions office. Obviously, you haven't completed your degree, so I would imagine that what they mean is that once you've completed your degree, before it can be made unconditional, they'd have to recalculate the GPA with the coursework that you're currently doing. May I ask, do we need to indicate in our personal statement which route we want to choose in the global healthcare management? Well, you apply by route. So your personal statement should be route specific. And when you apply, you have to apply to either a route. So now if you apply to more than one route, you need to adjust your personal statement for each of those routes. So you need to just give that some thought. Okay, well, thank you so much. That was tremendous, and lots of very good questions. Again, we really appreciate your time and your interest in the Global Business School for Health. If we haven't answered any of your questions, or I've asked you to write to us, please do, so that we can give you more information. And again, thank you so much for joining us. I look forward to interacting with you and getting to know you over time. And we really welcome all of your applications. So thank you so much, and have either a good evening, a good afternoon, or a good morning. Take care. Bye.